Number 15 and number 16 are similar in the sense that we're talking about predominantly after death. Most people don't want their estate to be left to a beneficiary that is struggling or suffering from substance abuse.
Big hot topic right now in the country, obviously.
It really is. I mean, I think that, and that's kind of, I think, if you tell me, but that's kind of a manifestation of a mental health issue that I think is just the elephant under the rug. Elephant under the rug? That makes no sense. The elephant in the room that gets
We can use elephant as the rug
under the rug.
if you'd like.
That was silly. I think mental health is a big deal. It gets overlooked. People don't respect psychology. They don't respect mental health. And then I think substance abuse is the byproduct of people being stuck at home, not working, not being able to see loved ones in this environment. It's a grudge.
Especially right now with everyone being stuck at home for as long as they are, it's
Yeah.
definitely becoming more and more of an issue.
So even if the COVID environment wasn't what it is, substance abuse and protecting beneficiaries from having access to money to buy more substances and not get the help they need was important already.
Yeah.
So I would say the only way to deal with that problem is to not give them assets or use a trust. If you leave it to statute, they might get the money and it will be gone. It will be gone.
It spoke about somewhere in the top 10 earlier about intestacy. Forget what number it was, but I know we touched upon that.
Yeah, intestacy is the statutory default for what happens in most circumstances, both during life and after death. It's decided for you, so it's not good. Substance abuse is important considerations.
Hey,